Ketamine therapy and psychedelic therapy is an exploding field in the medical space, specifically around mental health and chronic pain treatments. So, Fraser, before we discuss ketamine therapy specifically, I want to know what is the real problem or the main problem with traditional approaches to mental health and chronic pain? And where does ketamine therapy really fill that gap?
So, Mark, I think most treatments try and treat surface level symptoms. They don't actually get to the root cause of the mental health condition. So, yeah, a lot of treatments, whether it's therapy or antidepressants, they can take weeks or years to work or even get a little bit of relief. So, I think the beautiful thing with ketamine therapy that we're seeing with clients in the clinic is they're actually getting rapid improvements in their mood, even within 1 or 2 sessions. The just traditional treatments don't even touch the surface off. So, it's really that rapid relief and the ability to get to the root cause of these problems.
Fraser is the founder and CEO of Enthiomed, which is Kelowna's premier clinic for ketamine therapy and alternative pain treatments and innovative mental health solutions. Fraser pioneered the Odyssey Method, which is a holistic ketamine assisted psychotherapy model designed to create lasting change. So, Fraser, what is ketamine therapy exactly? And can you give people like a very dumbed down version of how it actually works?
For sure. So, ketamine therapy is a medically supervised treatment that can rapidly increase neuroplasticity. So, it does work on the glutamate system in the brain. So, it gives you this big glutamate surge. So, glutamate is one of your main neurotransmitters. And typically, what we would see is people that have, treatment resistant depression or anxiety, PTSD, or just chronic stress, their brain will have lower glutamate levels. So with the ketamine treatment, you get this big surge in glutamate that can really help the brain start to form new connections and healthier pathways. So with the brain being in this really neuroplastic state, the ketamine experience is only one part of the treatment. So when the brain is in this kind of neuroplastic state, we can really start to use the therapy before and after treatment to really reflect on that treatment, what potential emotional insights came up for the person, anything they were processing during the treatment, and then how we can take that insight and then form healthier habits, patterns, and behaviors post-treatment that can really help that person start to climb out of their mental health condition.
And you said it does something with glutamine, right? And so I'm not that familiar with glutamine. I've heard a lot of things about like dopamine and serotonin and like cortisol,
Yeah.
but glutamine is not really talked about in a lot of the online world. So what does that really? Yeah, what's that difference between glutamine or all those other more common brain drugs that people are aware of, or brain chemicals that people are aware of?
Beautiful question. So it's glutamate is the word. So yeah, your traditional psychedelics will work on your serotonin system. So your 5-HT2A receptor, your glutamate system is your NMDA receptors. So yeah, a little bit of a different system in the brain. So one of the actual cool things about ketamine is if someone is on a traditional antidepressant, they won't actually be able to do psychedelic therapy with things like mushrooms or MDMA. They would have to wean off of those for around 30 to 45 days beforehand. Whereas if someone is on an antidepressant, because it's working on the glutamate system, the ketamine I'm talking about here, there is no contraindication there. So a lot of times people can actually get relief with the ketamine treatment while they're on their traditional antidepressant. So it's just a little bit of a different receptor system in the brain.
Okay, so if I understand this correctly, the antidepressant and other mental health drugs are using one system in the brain, and ketamine is a wide or is being used a lot more because it uses a separate system, right? And so they're not really, I guess, conflicting. Is that right?
Yeah, absolutely. Nail on the head. And I think that's one of the big things we're seeing with the surge in ketamine therapy right now is ketamine has such a huge safety profile. It's been used for over 70 years in the ER in war, as a local anesthetic. And it was only kind of more recently that they've discovered the psychedelic properties of ketamine. So it can be a very psychedelic experiences at the doses we're giving it at the clinic. So yeah, very good safety profile. Children's dentists use it for sedation, etc. So that's really one of the reasons why, in the US and Canada, it's really kind of the Trojan horse of psychedelic therapy for the legal healthcare system.
Really, children's dentists use it for sedation?
Oh yeah, for sure. Yeah, so kids will have it in dental surgery. They'll use it in the ER, for instance, if someone has a break or something like that, because it doesn't affect the breathing system at all. So yeah, it's very safe drug for sure.
I had no idea it was used for so long in the medical field, like over 70 years, and in for children's dentistry as well. Why is there bit of a stigma around, specifically in the medical field, like around these psychedelic therapy models and ketamine specifically?
So I think it comes back to, the war on drugs. Like, for 60 plus years, we've been told what is an acceptable drug, what's a good drug, what's a bad drug. We can have coffee and alcohol in our society, but for some reason, these, drugs that were labeled back in the 60s, that can change your reality or make you go crazy. It's just kind of left an ingrained thought process in people that these had no medical benefit, because they were written off as a, class A drug. So there's no medical benefit at all. But what we're actually finding is there is a deep bench of research now to show that these treatments can help people with their mood, help them with their pain pathways, and really help them improve emotionally and functionally in their life. So yeah, I just think it's a lot of stigma and lack of education, really, because they were just tarred with a brush. Whereas now, with that education starting to change, the stigma starting to shift around it as well.
Yeah, and I see a lot more conversations being had around psychedelics. You have big podcasters who bring on well established and credentialed doctors who discuss these topics, and people like yourself as well, who at Enthiomed have doctors who have, yes, been in academic studies and in clinical trials with these. And so, we're seeing the tides turn on it a little bit from my perspective. And we talked a little bit about ketamine and mental health, but why did you specifically, why did you give me a personal story? Why did you choose to offer ketamine assisted therapy for mental health at your clinic in Kelowna?
Ooh, so Mark, so when I was younger, I was actually trying to play pro rugby. So before I was 21, I'd already had 3 shoulder reconstructions. And when my body kind of gave out and I just realized it couldn't hold up to the level of playing pro rugby, went through a big identity crisis, was very depressed, realizing my path in life had changed. And I was just living with so much pain in my body. I was in a really dark place in my life. And it was actually, a psychedelic session that completely changed the relationship I had with myself and my body. And, I've been in a pain-free body since 22 years old, and it's just really helped me. So when I was in my 20s, I had lots of friends and family members who went through, kind of bouts of depression or anxiety, or had some dramatic things happen in their life. And I'd always said, hey, what about a psychedelic session? And they were like, Fraser, like, you're crazy. How's this going to help me? Like, what? Like, I just don't understand. So after some kind of education, walked them through the process and then ended up sitting for them, they had these transformational experiences and they were like, oh my God, this is not what I was told it was or what I thought it was. So just seeing the shift from the use of it with some of the people close to me in my life, I was like, okay, there is something here. And really, it was kind of through the legalization of cannabis. So I was working at a tech accelerator here in Kelowna, and we had some cannabis clients that went through cannabis legalization. So really kind of seeing the whole process of that, I was like, okay, cannabis is legalized, psychedelics are going to be next. So, cannabis does have amazing therapeutic benefit or medicinal benefit, but it's a lot more recreational. Whereas I really think with psychedelics, there's such huge medical and therapeutic potential here that it's just going to blow cannabis out the water. And it's just, only a matter of time before this becomes mainstream.
Yeah. I mean, if you are listening to this video and you think psychedelic therapy is crazy, you should try playing rugby, because oh my God, I played a few matches and just got the snot absolutely beat out of me, and I was like, never again. That is crazy, playing rugby.
Yeah,
Uh,
not good for the body, Mark, that's for sure.
no, not good at all. So we discussed ketamine and mental health as treatment options, but it also is a treatment option for chronic pain. And you gave an anecdotal story from your own personal experience. Mind you, I don't think you used ketamine therapy during that. Um, but how does your clinic treat chronic pain, and how does that manage, and specifically when it comes to ketamine?
So beautiful question. So a lot of the time when someone is in chronic pain, their nervous system is so racked and inflamed. So some of the research is showing that these kind of medications are anti-inflammatory neural agents. So really it allows the whole nervous system to calm down and allow people to drop into that parasympathetic nervous system. So rest and digest. So especially for pain, the way our doctor describes it is it's almost giving people like a pain holiday. So because ketamine is a dissociative anesthetic, when people are deep in that ketamine experience, they won't have any awareness of their pain or their body. So it's really offering them that ability to just step away from their pain, calm down the nervous system. And then a lot of the time as well, when you've been in chronic pain, your nervous system or your brain is firing the same pain signal over and over again. So with ketamine, when you get that glutamate surge and increase in neuroplasticity, it allows the brain to start creating new neural pathways and new connections and potentially breaking those old pain pathways.
That's interesting. Is this for chronic pain? Would ketamine therapy be done in conjuncture with more traditional pain management, or I guess it might depend on the specific type of pain that someone's experiencing?
Yes, so great question. So, I mean, a lot of the time I would always say there's no, one quick fix. I do believe that a holistic, viewpoint and treatment path is the best way forward. So if someone's doing ketamine in conjunction with potentially, things like PRP, traditional therapy, even things like EMDR therapy or somatic techniques, really when you start to see multiple modalities, I think that's where you get this kind of multilateral improvement in symptoms.
And if you're watching this video and you don't know what some of these words are, I want you to let me know down in the comments. And if you want more explanation on things like somatic therapy, EMDR, which I personally am going to need some explanation on that, let us know in the comments, and Fraser and I will be sure to create a video on it. So we have discussed a lot about ketamine therapy, Fraser, but what are the risks with it, right? Like I picture my grandmother would say, like, don't do that. That is unsafe, because she just is unaware of everything that is really happening in the scientific field. But obviously there are risks with it, right? So what are those risks, and really who would your doctors potentially like say, no, we won't offer this to you?
So with every client, we do a mental health consult and a physical consult to make sure they are safe and suitable for treatment. So the biggest contraindications we would see where someone wouldn't be suitable for treatment or safe for treatment is, kind of uncontrolled high blood pressure, certain heart conditions, of course, pregnant individuals, people with active psychosis or untreated schizophrenia, or they've had a recent kind of schizophrenic episode, and also a history of ketamine misuse. So they're kind of the main bucket site we usually see at the clinic. And I think that's why the medical screening is so important, just to make sure the patient is safe, because again, when that person has the comfort, okay, I meet all the criteria, I'm safe, I have the medical support, that's what's really allowing them to have that presence of safety and feel safe enough to drop deep into the treatment, because that's where you can really go and explore that inner world.
So if people come to your clinic to do ketamine assisted therapy, either for mental health issues or for chronic pain, who are they working with? Like, are they working with doctors, and what do those doctors or nurses or medical professionals have in terms of like credentials in the psychedelic space specifically?
Beautiful. So yeah, all of our staff are, experts in their field. So for instance, for the intake, we have our psychiatric nurse and our, ketamine specialists who are doctors. So they will be doing the screening there. All of our therapists are, masters of clinical counseling or psychologists or psychiatrists. So really high quality professionals there that have all done their psychedelic assisted therapy training. And yeah, of course, our physicians, they could be pain specialists, they could be anesthesiologists, but they have done their training with ketamine and psychedelics. So really deep bench strength there, and making sure that the person is safe and supported through the whole journey.
And if you are interested, you should talk to your doctor, and also use the link down below and go to entheomed.ca, where you can then take an onboarding and have that consultation with a medical professional. And so to actually understand a little bit more about what it is, get your questions answered, use the link down below this video. and subscribe to the Odyssey Method with Fraser Johnston. And we will see you in the next video.